Good evening, good evening, good evening, good evening. Welcome everyone to this evening's webinar. We're so glad that you joined us, and we're so excited because as always, we have a great number of folks who are watching us on social media. Why don't you take an opportunity like I'm doing and share in your Facebook family. We do appreciate everybody that's coming in and being a part of what we're doing here on this National Baptist Convention USA Incorporated Hope Health Ministry. And this is a special webinar that we have planned for you all tonight. No, this is not our Temple Care Matters. Amen. This is a special webinar that we're having on syphilis on this evening now. Coming in and being a part of what we're doing. A special webinar that we're having on syphilis on this evening now. All right. Okay. So hopefully you've done that as I have. And now we can all be a part of this evening's webinar. Again, if you have questions or comments, feel free to put those into the chat or to the comment section, and we will be able to take it from there. All right. Again, we would love for you to share it across your social media platforms. Look, I'm already seeing you all are doing it. That's wonderful because we can see it on our end. This is an important webinar. So important that we decided to have one that was outside of our normal session. Okay. All right. All right. Let's begin by giving out a shout out to our awesome national leadership. Okay. All right. We acknowledge the national leadership, Dr. Jerry Young, our convention president, Dr. Alvin Edwards, our general secretary, Dr. Alvin Love, the chair of our federal faith-based development initiative. And I am glad to serve as your national director, and I'm also the convention's liaison to the U.S. Department of Health and Human Services. This evening, we present a special NBCUSA H.O.P.E webinar entitled Syphilis is Serious. Drug resistance and shortages, a national crisis. All right. Now, syphilis. We want to begin quickly by telling you that syphilis is a sexually transmitted infection, an STI, that can cause serious health problems without treatment. The disease can be devastating, causing serious heart and brain damage, blindness, deafness, and paralysis. Infection develops in stages: primary, secondary, latent, and tertiary. Each stage can have different signs and symptoms. Now, you may not know this, but babies can also get syphilis. Congenital syphilis is a disease that happens when people pass syphilis to their babies during pregnancy. Syphilis cases in the United States are skyrocketing, y'all, even as rates for other STIs like gonorrhea and chlamydia are flat or declining. Alarming numbers released by the Centers for Disease Control and Prevention are the latest marker in a decades-long rise of the disease, showing the highest case numbers since the 1950s. From 2018 to 2022, their cases rose 80% in our country. In 2022, cases of congenital syphilis among newborns were 10 times higher than in 2012. At 3,700 cases. Black and American Indian populations bear a disproportionate share of the burden, and women are making up a rising share of cases. Now, initially, this increase was mainly due to men who had sex with men. Today, we have parallel epidemics in two networks, one in men having sex with men and one among heterosexuals, which has been linked to drug use. The rise of syphilis cases among women is now surpassing the rise among men. All right. Now, to help us set the stage and prepare this before we get into our Q&A, which we know we have a live discussion tonight. And again, those that are watching on social media, feel free to put your comments and questions. We're going to do our best to capture your questions as well. We are fortunate this evening to have two dynamic speakers. We begin with Dr. Catherine Knapp. All right. Dr. Knapp is a board-certified pediatric infectious disease specialist with clinical and research interests in HIV, particularly in prevention of mother-to-child transmission and learn-term outcomes in perinatally exposed children and other other immunocompromised patients. She joined the medical staff at St. Jude Children's Research Hospital. We know something about that in the Memphis area. And she is in 2000. She has served as the principal investigator for the NIH-funded pediatric HIV/AIDS cohort study called PHAX SMART, which is surveillance monitoring for enteroviral toxicities. They're making me work on my pronunciation tonight. And AMP, Adolescent Master Protocol, studies since their inception in 2006. She's also the site principal investigator for HOPE, health, not our hope, but their hope, health outcomes around pregnancy and exposure to HIV, ARVs, and for IMPACT, International Maternal Pediatric Adolescents AIDS Clinical Trials. Group studies focus on HIV infected pregnant women and their infants. She provides diagnostic testing and management for all HIV exposed infants born in the Memphis metropolitan area. Wow. Dr. Knapp has a BA in psychology from Vanderbilt University and an MD from the University of Arkansas for medical sciences. She completed a residency in pediatrics at the University of Arkansas for medical sciences, University of Arkansas for medical science, and Arkansas Children's Hospital in Little Rock, Arkansas. She also completed a fellowship in pediatric infectious diseases at the University of Tennessee Health Science Centers, Le Bonheur Children's Hospital, and St. Jude Children's Research Hospital in Memphis, Tennessee. Woo! Welcome, Dr. Knapp. Dr. Knapp. Now, but look, now we got somebody well qualified to share with us tonight. Now, Dr. Knapp, it's okay with you. I would like for you to begin with your presentation about the syphilis STI, and after you finish, I will ask you several follow-up questions. Is that okay?
Sure, sounds good.
All right.
Okay. All right, thank
All
you,
right.
Dr. Miner. Let me share here.
Okay, you should be able to share your screen.
I think I have to share
Yeah,
this
share your screen. There you go. Share your screen.
Yeah, because I have to, all right, I may have to switch this because, hold on.
I know. There you go.
I've got two monitors, so hold on.
Okay.
Okay.
All right.
Okay, and now it's probably showing the wrong screen.
All right. Well, we see the presentation. We see the
Okay,
presentation.
you see the presentation mode, not the.
We see the presenters mode.
Oh, presenters mode. Yes. How do I fix this?
All right, everybody. But look, we made sure.
Toggle screens. Here we go.
Yeah, we made sure that Dr. Knapp was able to share. We didn't talk about
is it on the right screen now? No.
I still see your next slide.
Okay, let me stop and redo this. I'm sorry.
All right, everybody. Hey,
I forgot about this two-screen thing.
All right, look, everybody. We're live, so I'll give another opportunity for everybody that's watching us on Facebook. If you have any questions, anything, watch us. We want to welcome you to this evening's webinar. Okay. If you got questions, we want you to be able to pick it up. All right.
Is it on the right one yet? It's
Nope.
still showing presenter mode. I don't know what is happening.
Okay. Well,
Really?
we'll just see the one slide and your next slide.
Well, yeah. Okay, let me try one more thing.
Okay.
Let me get out of here.
All right. All right. All right. And we are typing in the chat now as we're doing for all those and across the across several different social media platforms. Thank you, everybody, for joining. Thank you all for that are sharing. Thank you for the shares this evening as we let as many people as we can across the nation know about this, about syphilis. Syphilis is serious. Drug resistance and shortages are national crisis. Okay.
Okay, I think it's on the right one now.
Okay. Yes, you are. You're good to go. You're great.
All right.
All right. It's
Okay.
in your hands.
All right, here we go. Sorry for the technical difficulties. Yes, we didn't practice that part. So thank you again for having me. I'm always glad to talk about syphilis. It can be a very bad disease, but it's very important to talk about it and tell people. Okay, so I have some resources from the CDC that I used in preparing this talk. There's a generic sexually transmitted infection page, and then there's specific pages for syphilis and for statistics for STIs, which I'll talk about. This is just an infographic from the CDC showing the state of STIs in the US for 2022. And that's the most recent year for which we have data available. There, as Dr. Miner said, we are having skyrocketing cases of STIs, and in particular syphilis, which, as he said, we've had an 80% increase over a 5-year period, and a 183% increase in cases of syphilis among newborns. Syphilis, as we said, is a sexually transmitted infection that can cause serious health issues if it's not treated. And as we've also said, can be transmitted from a mother to her baby. And this is what we call congenital or from birth syphilis. All pregnant women should be tested at their first prenatal visit. And some pregnant women should also be tested in the 3rd trimester of pregnancy, which they define as at 28 weeks, and at delivery. And I'll talk more about that later. There are stages of syphilis that I will talk about briefly and show some pictures. Nothing too graphic. So primary syphilis, the first stage, at this stage, this is the initial infection, and there are sores at the body site or sites that were exposed to the infection. And these sores are called chancres, and they are usually painless, and the person who's infected may not even notice that they have these sores. The sores typically last 3 to 6 weeks, and they will heal even if the person does not get treated. But if they are recognized and treated at this stage, that will prevent the infection from going to the next stage or secondary syphilis. So these are some photos of what the primary chancres can look like. And again, they are at the site of infection. So depending on what the exposure was, if it was via oral sex or sexual intercourse, you maybe see lesions at other areas, but I decided to spare you showing you other pictures. So I've just showed you some oral lesions here. Secondary syphilis usually starts with a rash. It may start when the primary sores are still there, or it may start several weeks after the primary sores have already gone away. And the classic presentation is involving the palms of the hands and the soles of the feet. You may also see some white lesions in the mouth or on the body, and the medical term for this is condyloma lata. And you may have some just sort of vague symptoms, or what we might call flu-like symptoms. Patients may have fever, swollen lymph nodes, sore throat, hair loss, which is something we see frequently in patients in my clinic where we see patients living with HIV, and headaches and fatigue. And this is the typical rash of secondary syphilis that involves the palms and soles. And I've shown these are 2 different patients. This was actually a Black African-American patient in our clinic, and this was a white patient that I got these online. And just to show you that the rashes can appear different. So you see in lighter skinned individuals, it may be sort of a reddish, and in darker skins maybe more of a dark brown, sometimes not even a very noticeable, depending on how dark the person's skin color is. And these are the same 2 patients showing how the rash can appear on the back. And this is also something we frequently see, rashes involving the back. Here are some other kinds of lesions that could be in the secondary stage. This is the condyloma lata. So these are kind of heaped up looking white lesions in the mouth. Secondary syphilis will also resolve without treatment, but you may have recurrences. So you may have recurrent rashes in someone who has not been treated yet for syphilis. But treatment at the secondary stage, just as if treatment in the primary stage will prevent secondary. Treatment of secondary syphilis will prevent progression to further stages of syphilis. Latent syphilis is, this just means there are no signs or symptoms of syphilis. And a latent phase may last for years without treatment. So this would be someone who's not having symptoms, but went in and requested STI testing, and they did a test for syphilis and found out it was positive. Tertiary syphilis, or a third stage, this is uncommon, but is very serious. And this may occur decades, up to even 30 years after the initial infection. And this causes damages to the internal organs, such as including the heart, and it may even cause death. Neurosyphilis is syphilis affecting the brain and the nervous system, and included along with this, we usually talk about affecting the eye or the ear, which would be ocular syphilis or otosyphilis. And all of these can happen at any stage of syphilis. So we can see these even in patients who present with a primary stage may have infection involving the brain. So to diagnose syphilis, what they do, it's a blood test, and there are two types. The one that is most commonly done is called an RPR. That's the one we use here. And RPR stands for rapid plasma reagent. So it comes back as either reactive or non-reactive. So if it's reactive, that means positive. And what they do is they result it as a titer. So a titer is 1 to 1, 1 to 2. And what that means is that's the dilution of the patient's blood sample in the tube mixed with some saline. So they mix it 1 to 1, the patient's sample and the saline. They take that out and put it in some more saline, and they keep diluting it by half. And then whatever is the greatest dilution that still shows up as a positive result, that's what's reported out as the titer. So treatment, penicillin is the recommended treatment for syphilis, and the dosing of it depends on what stage of infection the person is in. So it would be just 1 intramuscular shot in most cases. So for primary, secondary, or early latent. Early latent would be if you know that this person got infected within the last 12 months. So often we don't know that. But this would be a person, if you know they got a test done 10 months ago, it was negative, and they've never had syphilis before, and now they're positive, then you would know that's an early latent infection. Weekly injections for 3 weeks is recommended if you have a latent infection and you have no idea how long this patient has been infected. So this is what we frequently find, someone who just requests testing, they've never been tested before, and it's positive. So in that case, it's recommended to give 3 injections a week apart. Also, this is used for tertiary syphilis or for retreatment for someone who has been treated in the past for syphilis and now has a reinfection. Neurosyphilis is very important to diagnose because the treatment is much different for neurosyphilis. This requires giving medicine through an IV, and it has to be given every 4 hours for 10 to 14 days. So this is pretty much going to have to be someone coming into the hospital for an extended period of time to get adequate treatment for this. So what do you do if you're allergic to penicillin? There are alternative medications available, but it's very important to know that there are no alternatives for pregnant women. So the main alternative medicine that we use, doxycycline, should not be used in pregnant women because it can have adverse effects on the baby. So if a pregnant woman is infected with syphilis, it's recommended that if she reports an allergy, to do penicillin desensitization. So they might do a skin test first to determine if it's a true allergy. And then what they do is give some small doses of penicillin and gradually accelerate up to sort of essentially build up or desensitize the person to the penicillin so that they could safely give treatment. The follow-up testing, it's recommended to repeat the RPR test at 6 and 12 months after treatment. And then if if a patient is still reactive at 12 months and they have latent infection, to go ahead and wait and repeat it at 24 months. We know now sometimes patients stay positive much longer than we had previously thought. So these guidelines have sort of changed over the years. We expect to see a fourfold decrease in the titer with treatment. So for example, if the person's first titer was 1 to 32, a fourfold decrease would go down to 1 to 8, because 32 divided by 4 is 8. You would expect for early stages of syphilis to see that decrease by 12 months out of 8 after treatment. And again, by 2 years after treatment for someone with latent syphilis. The RPR is the first part of the test. It's confirmed with another type of test. The confirmatory test will usually stay positive for life, but the RPR test will usually become non-reactive after treatment. So this is a way both to monitor response to treatment and to assess someone to see if they've been reinfected. And again, having syphilis does not protect you from getting syphilis again. So if you became non-reactive after treatment and now have a new reactive test, that's consistent with being reinfected. Or if you are still reactive after your initial treatment, but your titers have increased fourfold. So like, as I said, we expect a fourfold decrease. Similarly, if your titer goes back up fourfold, that is consistent with being reinfected, and it's recommended to treat as a reinfection. Partners of people who have been diagnosed with syphilis, so any partners exposed within the past 90 days need to be tested and treated. So it's recommended to go ahead and treat them regardless of what their test results are, but they should be tested so we know if they were truly infected. For primary, secondary, or early latent syphilis, so again, those infected within the last 12 months, and if the infection is unknown, but they have high titers, sorry for the typo there, which would be defined as 1 to 32 or higher, which is presumed to be an early infection because high titers in the absence of treatment may become lower over time. So that's the recommendation. So partners within the last 90 days. All patients who have been diagnosed with syphilis should also be tested for HIV, and it's recommended that if the initial testing is negative, that the testing be repeated 3 months later. Congenital syphilis, as Dr. Miner said, has been increasing exponentially. It's increased every year since 2012 and has gone up over 200% in the most recent 5-year period. Congenital syphilis can cause stillbirth or infant death in up to 40% of untreated cases of syphilis during pregnancy. The babies may not have any symptoms at birth, but if they're not treated at birth, they may develop symptoms within a few weeks or even up to years later. This is showing on the left-hand side women of reproductive age, so women aged 15 to 44 in the US, and this is looking from 2013 to 2022, and you can see this huge increase in rates of syphilis among younger women. And on the right side, this is looking at pregnant women who have been diagnosed with syphilis. So this is also called maternal syphilis, and you see a similar rise here, mirroring that rise, and this has increased over 250% since 2016. This is just showing the rates of maternal syphilis in the US, and the darker states here are those with the most significant increase. These are increases of 400% or more from 2016 to 2022. And in my region of the world, Mississippi has the highest rate, 716.3 per 100,000 population. You can see that many of the states in the southern part of the US have high rates. The other states that have the highest rates in the US are Alaska, New Mexico, Colorado, Montana, and South Dakota. Signs and symptoms of congenital syphilis, there can be many manifestations of it. Deformed bones is one thing that is frequently seen. Anemia, increase in size of the liver or spleen, jaundice, which would be yellowing of the skin or eyes, rashes, meningitis or infection around the brain, blindness, deafness, developmental delay, seizures, low birth weight. So you can see this is quite a serious infection. Legal requirements for syphilis screening among pregnant women. Interestingly, there are no legal requirements in 8 states, and this includes Mississippi, which has the highest rates in the US. 16 states mandate testing at the 3rd trimester or delivery. 5 states mandate repeat testing only for those at increased risk, which is defined here below as someone living with HIV, someone with a history of sex with multiple partners, sex in conjunction with drug use or transactional sex, late prenatal care or no prenatal care, drug use, specifically methamphetamine or heroin use, incarceration of the woman or her partner, and unstable housing or homelessness. 4 states mandate 3 tests. So that would be at the initial prenatal visit, again at the 3rd trimester, and at delivery. So Arizona, Georgia, North Carolina, and Texas are those states. And that was all I had. Thank you very much for your attention.
Woohoo! Wow. This was a great presentation. I was taking a few notes as I was going along. This is just a whole lot as you really, thank you so much. I got several questions just based upon what you shared tonight, and I'm also going to be monitoring our chat. But keep in mind, everybody, we're going to have a general open after we get through our next panelist. We'll have a general Q&A session. So we'll go through these initial questions and maybe have what we want. And again, I want to thank everybody who's been sharing across social media. I'm seeing the number of people viewing across social media increase. So thank you. All right, so Dr. Knapp, do all babies born to mothers with syphilis get congenital syphilis?
No, not all babies will get congenital syphilis. The risk is highest in the early stages of syphilis because that's when the higher load of the infection is. And syphilis can cross the placenta pretty well. So there's about a 70% risk of syphilis getting across the placenta. In 2022, there were about 10,000 deliveries to women with syphilis. And again, I reported approximately 3,800 babies who were affected. So it's a significant portion of them. It's not all of them, but it's very important to note that this is almost 90% preventable. So if we get women into prenatal care, identify them being infected, and then treating them appropriately, they have to be treated more than 30 days before the delivery needs to be with penicillin. So if all of those things happen, that decreases the risk more than 90%. So it's very important to get early screening.
Well, as the saying goes, an ounce of prevention beats a pound of cure. What can people do to protect themselves from getting syphilis in the first place?
Okay, so obviously the best way is not to have sex. But for those who do have sex, condoms can prevent transmission. It's important to note condoms will only prevent transmission if there are sores that are not covered by the condom, then there's still a risk of exposure to those sores. You're still at risk of getting infection. And then there are some promising new things on the horizon that are just sort of starting out. There's something called Doxy-PEP that people may have heard of. And this is a post-exposure prophylaxis using the drug doxycycline, which is an alternative treatment for syphilis for people who are not pregnant and for babies. And they have shown that STIs, syphilis, and chlamydia can be decreased significantly in people who take this post-exposure prophylaxis. So right now it's only recommended because it's been studied and shown to be effective in males who have sex with males who have a history of one STI in the past 12 months. And what they do is they take two 100 milligram tablets within 72 hours of unprotected sexual activity. And doses can be taken up to daily. And this has been very effective, again, in males who have sex with males. To date, there's only been one study looking at doxypep in women, and that did not show efficacy, but there were concerns about adherence in that study. So it's something that's actually being studied now. So hopefully down the road, that will be also available for women.
Okay. All right. Well, speaking about the drugs, you mentioned several drugs. Is there a drug resistance problem with syphilis today?
So in the past, azithromycin, which could be given just even as a one-time dose, was used, but there was resistance that developed to that. So that is no longer recommended for use. The bigger problem we are having lately is drug shortages.
Mm.
So the intramuscular shot, the trade name is Bicillin. There have been shortages over about the past year. I think last summer
Okay.
was when it started. As of a couple of months ago, the drug manufacturer said that they believe that there's adequate supply everywhere now. So that's been the more concern with that. And as people in the medical field know, seems like there's drug shortages of everything these days.
Yeah.
So that's the bigger concern right now.
Okay. All right. Well, why do people diagnosed with syphilis need to be tested for HIV?
So we know that there's sort of co-epidemics. So we know that a lot of people infected with one are infected with the other. And syphilis does increase the risk of transmission and acquisition of HIV. So the sores create a portal to facilitate the entry of HIV. So because they occur frequently together, it's important to get tested. And also for syphilis specifically, there are different recommendations for treatment and follow-up for someone who is HIV infected. So it's important to know their HIV status as well.
Okay. All right. Well, you know what? You know what we're gonna do? Because I got a question in the chat for Zoom and a couple of questions from social media. Let me go and get to the second part, Dr. Knapp. So just be ready. Get your swallow water
Okay.
because we're gonna have another slew of questions coming up here. And I don't believe y'all. For those that are watching on social media, I'm grabbing those questions. But we're gonna go to the part two, what we have. Again, thank you, Dr. Knapp, for this first part. Um, and we'll have some more in our general Q&A session at the end of this webinar. All right, now we transition to part two of this evening's webinar. And again, everybody, both on our social media and on Zoom, we got your questions, and we'll be able to ask those in our general Q&A section. All right. Now we've heard from the clinical side about the ongoing syphilis crisis. What about the laypersons, outreach and education? That's where we come in from, our 31,000 National Baptist churches. Our next panelist is one of our NBCUSA H.O.P.E team members, Sister Bettina Campbell. Let me just say a few things about Sister Bettina. Sister Bettina is the Director Emerita of Your Center, a faith-based community organization in Flint, Michigan. It provides a comprehensive array of health disparity and social justice, education, and prevention services. Since 2004, Sister Bettina has worked on several intervention and research projects, collaborating closely with community-based organizations in Flint, Michigan, as part of the Prevention Research Center of Michigan, PRC. She has served community primary partners in research that increased for several federally funded and foundation-funded projects. The NIH partners in research that increased 40 CBO's leadership knowledge of healthcare, research, and improved collaboration between scientists and community organizations. The Healthy Sexuality Research Project, funded by the CDC, focused on using social media to support HIV STI prevention. This project recruited and tested over 500 African Americans, 18 to 25. Sister Bettina is the community primary investigator for the Flint Resiliency in Communities After Stress Faith-Based First Responders Program. It's a mouthful. A 12-month train-the-trainer project that serves over 7,100 congregants and families. She is a licensed master social worker, and for the NBC USA, she's also serves as our National Mental Health A Better Way coordinator. Welcome, Sister Bettina. All right. Well, Sister Bettina, you know, I got to ask you some questions off the bat. What can we do? Okay. Our 31,000, over 31,000 churches for the National Baptist Convention, and make sure you unmute your mic, do to help us in alleviating this syphilis crisis? That's kind of a loaded question. So I guess you can give me 2 or 3 little tidbits there, and we may get some more later on. So go ahead. What can we do?
Well, first of all, many of the churches already have Hope Health teams, and health ambassador teams, and so they can make sure that those teams are trained and able to do presentations or bring in someone from outside that's qualified to do presentations about HIV and STIs. So because we want to teach personal responsibility. We can also make sure that those teams are working to reduce stigma within our churches, because a lot of people don't want to talk about sex. We had 2 presidents that couldn't talk about HIV, and that's why it's at the level that it is today. So
President of the United States.
Getting trained.
President of the United States.
President of the United States.
Yes.
Yes, sir. Maybe make sure I clear that up. President of the United States.
Right. Okay. All right. Hope you heard that, our health ambassadors, and thankful for the number of health ambassadors that are on watching us across social media. Good evening. All right. Let's get information. And it makes sense. Well, I guess the thing is, why do you think that many of our churches, not just National Baptists in general, are more active in outreach and education efforts and around syphilis and, of course, other STI prevention?
Well, again, it goes back to that thing called stigma, being able to talk about it. Sex in general, our reproductive health system, especially our women, they have such derogatory names for it, already look cutesy names, and so they don't talk about it, because if we don't talk about it, it doesn't exist, it's dirty, it's nasty, and it makes it easy for us to put it at risk. So first of all, we got to start talking about the fact that that our reproductive system is not just sex, it's our reproductive system that's affected, and our reproductive system is what produces life. And so in order for those babies that we talked about being born with syphilis not to be born with syphilis, we have to teach people personal accountability, helping them to understand what sex is, giving them the proper terms that they can use when they're talking to their children, when they're going to the doctors, and having conversations with their doctors about sex, teaching them how to have those conversations. And one of the tools that we used specifically with churches in Flint is called Your Blessed Health. And it was developed by 7 first ladies of the church and across 4 denominations. And so it was not necessarily Baptist specific, but it was looking at how faith communities can deal with HIV, STI, and reproductive health, and how it's important for us to be able to do so. Again, teaching personal responsibility, because it's all well and good to be mad at somebody because they infected you, but did you have that conversation with them? And part of the problem is that we don't know how to have that conversation, and especially women. We don't know how to have, because if women start trying to have a conversation with a man, he's gonna look at her sideways and wonder what you've been doing. And so it's important that we have that conversation.
Well, can you give me like maybe a couple of things that really you found success? I know you talked about things working with the first ladies, and the other thing you found that have helped you with your success with congregations.
Well, I know that when we have our pastors educated, okay, and they're talking about it across the pulpit, that helps to destigmatize it. Again, getting the teams trained, not just talking about sex from that young people are having sex, that all people are having sex, because we don't like to acknowledge the fact that grandma and grandpa are still having sex and need to be educated. We're sexual beings from birth to death, and so acknowledging that and talking about that. One of the other strategies that we used was not just having we had a program that did 5 weeks of training with young people, but before we did the training with the young people, we trained the pastors and their Christian education leaders. Then we trained the parents so that the parents know what kind of information is being given to their children. They feel comfortable with that information, and they can carry on that conversation after they come out of those sessions. And then we did the 5 weeks of teaching young people how to first look at what their beliefs are, and then how they are communicating those beliefs. So teaching them decision-making skills, teaching them communication skills and negotiation skills, and then helping them to develop a plan for how they can keep themselves safer. And so those are strategies that have worked well for us.
Okay. All right. Well, so coming back to our National Baptist, because of your great work that we're doing it, we were able to add several observances to our annual Suggested Health and Wellness Observances calendar for the National Baptist. So how could we use those? They are on the calendar. So how could our congregations use these observances in the efforts to alleviate syphilis and STIs?
Well, again, they can, the health teams can make sure that there's information. One of the things that we do say at the Heal Hernando is that we have a table, and we have handout leaflets, we have the red ribbons, and we have plackets that talk about HIV and what it is. So making sure that the congregation is aware. We put an announcement in the bulletin. And so as these different awareness days comes up, we increase the number of activities around that so that we can make sure that people are aware. We've been fortunate enough to bring in speakers who are HIV knowledgeable. Dr. Pishan here in Memphis in Mississippi and has come in to talk to us. And so, just we did at our women's conference, we did a whole workshop around it, and so it's just a matter of making sure that there are tools and information and people that are knowledgeable about those tools and information to provide it for the congregations.
Okay. All right. Now, what would you say to all those working in local congregations that they've been trying to do this and they're ready to give up because of apathy or opposition in their churches to syphilis and STI outreach and education? What would you say to them?
I would say to them something that Pastor Danielle Griffin in Flint, Michigan said to me when I first went to them to start to talk about HIV. And he said that the churches are aware of the fact that HIV exists. They're even aware of the fact that HIV is infecting their congregations and their family members. But the issue that they had with it was being able to talk about it because of all of the information that was out there was information that that was antithetical to everything the churches teach. So they say, if you can come up with a way that we can teach this message without violating what our beliefs and doctrines are, then we will be more than happy to. So that's what Your Blessed Health is. Your Blessed Health sat down with the first ladies, and then we took the message to the pastors, and we said, okay, based on this is what CDC says must be in an intervention that is going to be effective. How can we deliver this intervention in your church based on your doctrines and your beliefs and the vision and mission that you have for your church? So if you come at it from that way and you give them some power and some buy-in into it, I think that you start to have success. We worked with over 60 churches using that method.
All right, great. All right. We've covered a lot of things in this discussion. Before we get to our Q&A section, is there anything else you would like to add before we move forward?
I would just like to say again that it's a personal responsibility. So first, get tested, know what your status is, and then share your information with your friends and your families, and just fight, just so that we can erase the issues like HIV and like syphilis, so that our babies are born healthy and whole.
All right, it's wonderful. Thank you so much, Sister Bettina. You really enlightened us this evening. Now, before we begin, I want to our general Q&A section. I want to remind everyone about our NBCUSA annual session week after next, September 2nd through 4th in Baltimore, Maryland. We'll have several health fair booths there, including the American Kidney Fund, Sickle Cell Disease Association of America, and the U.S. Department of Health and Human Services COVID-19 flu and RSV outreach. So we hope to see those that are going to be there for it. Come by and visit us there at the annual session of our National Baptist Convention, USA Incorporated. And also we'll hear our president, that's Jerry Young, will give his benedictory address. Amen. As president. All right. So it is now time for our Q&A. And we'll bring everybody up again. So we'll bring Dr. Knapp up, and we'll bring Sister Bettina. Boy, we got questions from social media, and we have questions from our Zoom here. So we'll go through them. I think we'll go and take this one first. And I guess I'm going to make the copy and put this in the chat as well. Some folks have asked us, what are the National Baptist events that did on STIs? And I'll put those in the chat. In February, we have National Black HIV/AIDS Awareness Sunday, which is the first Sunday in February. And then on the 7th, that's the National Black HIV/AIDS Awareness Day. All right, in March 10th, is a National Women and Girls HIV/AIDS Awareness Day. That's March 6th. And we're sending it up here, and we put it in the chat so you'll have it. All right, and this is also part of our calendar of our it's on our 2024 and 2025 calendar. All right, that's March 10th. And then on September 8th is National HIV/AIDS and Aging Awareness Day. That kind of coincides for us when we do things with our senior month, senior activities, and what we have. All right. Okay. And then in December, we know that's the big one. December 1st, World AIDS Day. So those are the ones that we highlight that we have on our health observances, for the National Baptist Convention USA Incorporated. All right. And if you don't want a copy, you can go to our Health and Services page. Go to our site, hopenbc.com, and you'll be able to get the information there. All right. Okay. This next question, it asks, what are the statistics of a person becoming blind from syphilis? What are the statistics of a person becoming blind from syphilis?
Okay, so ocular syphilis is pretty uncommon. It occurs in less than 1% of cases of people who have been diagnosed with syphilis. And it's mostly what happens is there's inflammation of the eye that causes blurry vision, maybe some pain or redness, and that there can be some decreases in the vision. And with treatment, that can improve or not worsen. So I don't know any specific data on going blind. I would say it's very, very rare because even any involvement is less than 1% of the cases. And I haven't seen any data on total vision loss. Most of it's more of a mild vision loss.
Okay. All right. Another question says, are there any special federal program, state program for persons with syphilis? I guess you're probably talking about from assistance or something that people who are diagnosed with syphilis. I'm assuming that's what the question was talking about.
I am not aware of any federally funded programs to assist people with syphilis. I know there's now a national STI program for try to prevention that's only happened in the last couple of years. So that's good. That's progress. So there's been more efforts on trying to get people tested and treated.
Okay. All right. What do we do when someone comes to us? Oh, okay. I guess you're talking about the church. What do we do when someone comes to us and they say they are syphilis positive? I don't know how to answer that question. Maybe Sister Bettina? Yeah.
Well, first of all, you want to make sure that they have actually had a syphilis test and been diagnosed by a medical professional. And then after that, you ask them what is it that you can do to help them. You want to make sure if they need help with their medication, they need help purchasing it, if they need help with reminders on when to take it, and then if they just need someone to talk to for comfort, and if they're seeking help for mental health, then make sure that you have someone qualified that you can refer them out to. And if they want spiritual help, they may ask you to pray for them, pray for them.
All right.
But by all means, don't judge them.
Okay, definitely. All right. Well, Dr. Knapp, I'm assuming that most medical insurance will cover the medication for syphilis.
Yes, definitely.
Okay. That question is bothersome to me. I think that question, I know we've had some situations where things have come in the church where a person may end up with the syphilis from somebody in the church. So let me step out from a second and put on my pastoral hat. I think when people come to us in the church, we need to, as the same thing as Sister Bettina says, not be judgmental, but we may want to look at getting some other professionals involved because it may be a situation that that person may have been infected from somebody in the church. So things like that we have to be careful about and look at and be concerned with, especially they come to you saying that. Of course, somebody may have said that they have it because they had intercourse with someone and that someone said they had syphilis. But anyway, folks, let me just say what I always say. Just don't put folks off by saying, honey, I'm going to pray for you tonight. So we need more than that, okay? But y'all come with some serious questions tonight, okay? Okay, we got the services. Okay, so that I guess I'm gonna understand this question. So I guess why do some of these drugs become resistant? I mean, yeah, I guess when for drug resistance to some of these the treatments. I guess is one reason. I think what's behind it, Dr. Knapp. My stepfather, they'd always give him a regimen of antibiotics to take, and they said take it for 7 days. If he started feeling better in 3 days, he stopped taking it.
Yes,
So
that's
I think
bad.
maybe something behind it. Okay, so just jump on in there where you can feel with it. Okay.
Yes, always take the medication as prescribed.
Mm-hmm.
So that is one way that we just call them bugs. Bugs can become resistant is if they're inadequately treated. So bugs are smarter than we are, and they know if you don't give them the treatment for the period of time they should have it, the ones that are there that are not responding to that drug they get stronger, they develop resistance, so they get to where that drug no longer works. So that's the most common thing we see is that people are not taking things as prescribed, and the bugs outwit us, and the drugs no longer work. That's the most common thing we see.
All right. Oh, wow. Can you get syphilis? So, okay. Can you get syphilis with counseling somebody in your church who has syphilis? I guess they're saying other than intercourse. This is like a question if you shake their hand or hug them or something. This is what I'm getting from this question. You know what I'm saying? I think that's what that question was asking.
It is not passed that easily, or
Okay.
we would all have it. Yes, it requires intimate contact
Okay.
of some sort for transmission, and contact with the sores. That's where the bacteria gets spread through that way. So it doesn't come from any casual contact with anybody.
Right. I'm reading between the lines, and I think sometimes I think what it's saying sometimes when you maybe counsel somebody, you want to give them a hug or shake their hand, stuff like that. I think that's where that's coming from. Now, they didn't say that, but I'm just trying to feel okay.
Yeah.
On that particular one. All right. So again, social media. Anybody that's on Zoom, questions. We're gonna go just a few more minutes of oh wow. So the question is, I guess they've read with the part where it may be a delayed, it may be late, dormant for a while. So okay, I guess you're ready get ready for this question. Does that have anything to do with what happened with the Tuskegee experiment? Some of this thing maybe it's coming back up because of what happened years ago. I think I already know the answer to this, but it was asked, so go ahead.
So are they asking, is that why we're seeing more cases?
I think what it says
now?
that, is it, in other words, is that it's all happened way back when. Now this is why it's been out there latent, kind of dormant, and now coming back.
Oh, no. Yeah, syphilis has been around forever. I mean, we don't know when for millennia. So syphilis has been around. And the Tuskegee if people who don't know what that was about, there was a study looking at the natural course of syphilis among Black men in the South. And while they were doing this observational study, penicillin became known as a treatment for syphilis, and they withheld that information from the people in the study and did not treat them, which is completely unethical. And but that has not affected resistance or rates of infection. So once syphilis, penicillin is still remains all these decades later the treatment of choice. And we saw a decrease in rates, and they've been going up over the last couple of decades. And a lot, they think a lot of that as I don't know, since 60s and 70s, where casual sexual encounters became more common, we saw increases again in rates of all these infections. And then, as we know, with HIV being first described in 1981, and then we started seeing higher rates of syphilis among males who have sex with males. So that's where it all started again with the higher rates.
Okay. All right. For all those conspiracy theorists out there, put those things together. Just that is nowhere. I only said that they brought it up, but I think that's important, Dr. Knapp, Sister Bettina, for us to look at some of this. I guess you're saying in a nice way. There are a lot of misinformation out there that people have. So I think it's important for us that are on the call, that health ambassadors, whatnot, have these conversations, and to put out the truth. Too many people watching us on social media and what other people have to say, and coming out, and what we have. Okay. So I guess that's the last question I have, unless somebody else puts anything else in here or on it. Okay. It says that there's a lot of states that don't do testing for syphilis for expectant mothers and whatnot. So can the mother or I guess if it's somebody underage, the specifically ask for that test, would it cost anything to do it? I guess I'm in the other part about this, the grandmother or whatever, or the mother.
Yeah, so
Yes.
it's recommended, and definitely insurance will cover testing at least once during pregnancy. More states do, or what am I trying to say? I mean, more states want either a test in the third trimester, and if not available, one from delivery. So those would also be covered. So the ones that test 3 times, that's not very common. So usually in most places, because there are such high rates now across the US, in most places it's within the guidelines to do a repeat testing in the third trimester. So
Okay.
yes, it's covered, and it's actually not a very expensive test, and penicillin is not an expensive treatment. So.
And
All right.
I can attest to that fact that when it's done that way, it does bring down the rates, because I forgot to share with you that one of the strategies that we used in Flint when we had a syphilis epidemic in Flint, we engaged the churches, and they went out and passed out flyers about syphilis along with their tracts about church, about religion. And they opened up their churches for testing sites so that we could have non-traditional testing sites over in the evening, and at the different at choir rehearsal, at Bible study, we offered testing, and it really did bring down the rates. And then we worked with the doctors, and we had it in Flint, in Genesee County, where it was mandated that they would test them 3 times when they first came in, then in 28 weeks, and then again just before birth. So it worked. We have papers or studies out there that show that it worked. So.
Okay. All right. Well, that was it. Boy, I tell you, my hat's off to our NBCUSA family. You all presented us some challenging questions. I guess maybe some of our extended family that are watching. And again, that's all that we have. This will conclude. Of course, Dr. Knapp, you hang tight. We're going to come back after we get off Zoom. So let me go through and we'll do our final follow-ups here. Okay. for what we have. Duke, that link for the webinar, we need that webinar, the link for the webinar evaluation. All right, so this concludes our Q&A period. Hope that everyone will join us for our monthly Temple Care Matters webinar. That'll be on Tuesday, September 10th. Tuesday, September 10th. It's going to be the second Tuesday because the first Tuesday will be in our annual session. Our agenda will be National Childhood Obesity Awareness Month, Sickle Cell Disease Awareness Month, and of course, our revamped NBCUSA Hope Sickle Sabbath Sunday, September 15th. Sickle Sabbath Sunday, September 15th. And if you have not NOT, that's what I said. If you have not had a chance to download the toolkit for it, do so. Go ahead and download the toolkit, and it's got great information there for our Sickle Cell Sabbath. And while I'm on that, we will not have a chance to talk about Senior Sunday. We have a toolkit for that as well. All right, and put some pictures, take some pictures, and put them out on our social media page, on our Facebook page. We love to celebrate our NBCUSA Hope family. You can find additional resources there at hopenbc.com. Again, our annual session, 144th annual session of our National Baptist Convention USA Incorporated, September 2nd through 5th, 2024 in Baltimore, Maryland. You may join us on the web and social media. Our webpage, again, is hopenbc.com. Our Facebook page is National Baptist Convention USA Inc. Hope Health Initiative. Our Twitter feed is @Hope_NBCUSA. And our YouTube channel is NBCUSA Hope. And that's H.O.P.E. If you'd like to enroll in our NBCUSA Hope Health Ministry training in person or self-paced online, email info at hopenbc.com or call 901-603-0762. That's 901-603-0762. All right, again, don't forget to complete your survey. As my late godfather said, the biggest room we have is the room for improvement. Okay? We appreciate the tireless work of our NBCUSA Hope team. Yours truly, Dr. Michael O'Miner, Dr. Desi Levy, Sister Lottie Miner, Sister Nettie Johnson, Pastor Dexter Moraney, Sister Ella McKnight Hill, Dr. Felisa Washington, Minister Geraldine Moore, Sister Loretta Miller, Dr. Lavora Williams, Sister Bettina Campbell, Dr. Marion Talley, Brother Thomas Duke Robinson. Our 7 regional coordinators, Pastor Daniel Blackburn in Northeast, Sister Brooklyn Rogers, Southeast, Pastor Bernard Montgomery, Southwest 1, Sister Linda Carper, Southwest 2, Sister Teresa Fields Farr, Midwest, Sister Farah Robinson, West, and Pastor Richmond Johnson, Far West. To connect with your regional coordinator, again, email info @hopenbc.com. Now we know that some of you all have additional questions or comments that are on Zoom, so we'll formally close this evening's webinar in just a moment. For those joining us via Zoom, we'll open up the mics for another general Q&A session. We will see you all on September 10th, 2024 for our Temple Care Matters webinar. Finally, we acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a broadcast of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless you and God keep you is our prayer.